Hi, and welcome to the Psych, Health and Safety podcast. My name is Jason Denshi, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we would normally have regular guests from around the world who are leading the way in this important area. However, today is a very special episode. With me, I have Joelle and Alicia from the team. How are you guys today?
Good, Jason. We can also be international experts who are leading the way in this field.
That's true.
Yeah.
We'll let other people say that about us. How are you, Alicia?
I'm doing much better now. My online window shopping is about to become a reality. Retail opens in Melbourne on Friday. I've made my list. I'm sure everyone else in Melbourne is feeling me at the moment.
Yeah, so whilst Joel and I have been enjoying the freedoms that our state allows us, Alicia just starting to come out of the most lockdown state in the world, and hopefully get some freedoms back. That'd be great.
I'm going shopping on the weekend. I'm very excited.
Please do. Hate to see your credit card afterwards, though. Now, many of the regular listeners would be aware that besides producing this podcast and providing free training on psych health and safety through the 45003 Academy, Joelle, Alicia, and myself are the subject matter experts behind FlourishDx, a software tool developed specifically to help companies adopt a psych health and safety approach easily and globally. This week, we're really excited to announce the release of FlourishDx Basic. This is a free way for teams of up to 12 people to get access to many of the premium app features and content. It's another way for us to enhance the capabilities of people and safety professionals in this space in a highly accessible way. Now, something though that's come up a bit recently when we're talking with customers is how FlourishDx differs from other workplace mental health apps. Many, I feel, don't understand the difference between what is typically deemed workplace mental health versus what is psychological health and safety. And that's why we've come up with this idea of a workplace mental health maturity continuum. It's something that we've spoken about with some recent guests on the show. And we really feel it's useful to explain the different needs of a company in relation to employee wellbeing and how FlourishDx can help mature a company's approach in order to have a better impact. So full disclosure, unlike other podcast episodes, today we will be speaking about the FlourishDx product, but there should still be plenty of good information for all to take in. So maybe to start us off, Joelle, what is a workplace mental health maturity continuum?
Right, well, it's something that we made up first and foremost. Very importantly, I want to be clear that this has not been developed out of any research. This is purely sort of anecdotal, I suppose. So it reflects really a collection of observations that we have made in discussions with clients, and also feedback that we've received from colleagues, podcast guests, etc. So I suppose you could maybe call it a model that's been developed by a group of subject matter experts. Let's call it that rather than just a made-up model, hey?
Yeah, sure.
Yeah, all right. So this is a subject matter expert model.
But it's based on anecdotal evidence rather than like research-backed evidence.
So I guess it's based on experience rather than any rigorous research methodology. Basically, it sort of takes us through the steps that we observe organisations tend to follow in their journey to implementing a psychological health and safety approach within their organisation. And so in terms of our, I guess, the X and Y axes, along the X axes, we're talking about maturity, and that's really starting at where an organisation will view mental health as being the individual's responsibility. So each individual is responsible for their own mental health. And so organisations might provide them with, things like an employee assistance program, maybe some resilience training, some mindfulness app, or those types of things to encourage individual employees to maintain their own mental health or to seek treatment when they need it. And so that's very much viewing mental health as an issue that resides solely within the individual and is solely the responsibility of the individual. And then on the other end of that axis, we have things like the ISO 45003, which is really a a safety management system approach to psychological health and safety. So this is really a very mature approach where psychological health and safety is embedded across all of your business processes and practices, forms part of your business as usual every day, as well as facilitating continuous improvement. And then there are other steps along that continuum as well.
Yeah, so for those listeners who are interested, we will drop a link to this maturity model in the show notes so you can get access to that, so you'll be able to follow along as we talk about this. And also this is being recorded as a webinar, so it will be available on the FlourishDx YouTube page, and we'll have a link to the model there as well. So really what we're talking about, as you say, in terms of increasing maturity, is we're going from a focus on the individual to a shared responsibility for workplace mental health.
Yes.
Yeah, and something that's integrated, I guess, into how a company does business versus just being an activity that's done on the side.
Yeah, or yeah, when people remember to do it. Yeah.
Yeah, that's right. I think the other thing when we talk about maturity is the level of leadership commitment that's required and the number of resources that might be required. So whilst it might be very simple, maybe not exactly cost effective, but it might be simple to just make an EAP or a telephone number available to employees to access, or give them access to a mindfulness app, for example. There's really not a lot of leadership commitment that's required. Doesn't really take any change management to introduce something like that. Whereas if we're talking about ISO 45003, this is something that you have to think about very carefully and do a lot of planning and work to integrate into what you do.
Mm.
Yeah, so we'll talk a bit more about that as we go through. But Alicia, we talk a lot about the integrated model. You used to work with Tony Lamontagna at Deakin University, and so you know this model very well. And we really do base FlourishDx on that model. So how might this maturity model that we're talking about today fit within that approach?
Yeah, so the integrated approach, when we're talking about workplace mental health, for those listeners who aren't fully aware of what that means, we're referring to 3 areas that you need to consider and address in order to actually do workplace mental health effectively. So it's an evidence-based approach, like you said. It's Tony Lamontagna was on a recent episode of our Psych Health and Safety podcast, and the whole episode was dedicated to this integrated approach. So it's talking about preventing psychological harm or psychological injuries. It's talking about promoting mental health and, what that looks like in a workplace, and focusing on the positives of work. And it talks about managing illness or supporting recovery if someone is actually not well. How do you do that within an organization? What do you provide to injured workers to support them back to good health? So there are those 3 areas: prevent, promote, and respond. So the model that we're talking about, the maturity model, when we're talking about workplace mental health, from what Joelle was saying, down the left-hand side, the start of that x-axis is talking about, promoting mental health, promoting self-care up to the individual employee. So that's based on that, promote mental health. So what are we doing? What are we providing for our staff to look after themselves? But also, how do we promote mental health in other ways from an organizational perspective or a team perspective? So increasing mental health literacy across an organization, helping staff and managers understand, what mental health is on a continuum, and not just mental health, but what is, psych health and safety as an organizational responsibility, and how do we foster that within an organization? And as we move up that x-axis to full maturity, it's actually preventing harm involves taking a psychological risk management approach. So if you don't do that, you can't actually prevent harm. You can only kind of respond when harm's occurred, or promote mental health, but you can't actually prevent it unless you're taking this risk management approach and understanding what risks and hazards are that are coming from the workplace. You need to first understand what that means. How do we assess that? And then how do we respond to these risks once they're identified, and continually just review the strategies we put into place, the solutions, the control measures, and keep assessing risk that becomes business as usual, not just, like you said earlier, a one-off activity.
Yeah, so it's about continuous improvement. So I guess what you're talking about here is we're really thinking about, with this maturity model, that we're trying to cover all aspects of the integrated model. So respond to illness, prevent harm, promote the positive. But we're also trying to consider what's an individual responsibility and then what's the employer's responsibility or obligation. So it's tackling it from both perspectives as well. And like as we said, the more mature approaches will deal with workplace mental health as a shared responsibility, not just something the organisation does, not just something the employee does, but working together to get outcomes. So that's the x-axis, I guess, and how it fits in with that integrated model. The other bit is the y-axis, where we talk about benefits. And we feel the further we move along that maturity model, then the greater the benefit is going to be for employee mental health. So Joel, what would be some of the benefits that we'd expect to see from companies maturing their approach?
Yeah, so I think there are a number of different benefits. And for those listeners who are looking at sort of business case perspectives here, I guess this is the time to crack open your pen and start taking some notes. Ultimately, it's about what's important to your particular organisation. So if you've got high turnover, we know that there's a really strong relationship between an organisation that supports employee mental health and reduced turnover rates. So that's one. There's workers' compensation claims is another fairly obvious one, which is going to be strongly linked to your compensation premiums. So anything that you're doing to reduce psychosocial claims, which are particularly expensive, is going to help you with your premiums. And then we've got other things like absenteeism and presenteeism, which can be more difficult to measure, but is certainly impacting on production outcomes. And then also I think we do have things like employee engagement and morale and all of those, I guess, more intangible things that still contribute to positive work outcomes and productivity outcomes and all of those good things as well.
Yeah. And did we talk about meeting legal obligations as well?
We didn't. That is an important one. Yeah. So so I guess where you're, depending on where you are in the world, your occupational or work health and safety regulations may include general duties to protect employees from harm, essentially. So to provide a workplace that is safe and without risk to health, or some wording like that. Some legislation will specifically talk about psychological health, but whether or not it talks about it, it's still part of health. So where you do have those general duties, then you do have that duty to provide a workplace that is free of psychosocial hazards, or that you've taken reasonably practicable steps to reduce exposure to those hazards and to provide recovery for people who have been exposed.
Yeah, so we see the less mature approaches really, because it's just a focus on the individual. That's the company not actually understanding their responsibility to create a healthy work environment and therefore not meeting their obligations under legislation where it exists. But we do see that as you mature, then you do take on more risk-based approaches, which do actually meet the legal obligations.
Yes.
Yeah, great. Well, what we might do then is to talk through the various levels and just give it a bit more context and talk about, I guess, how it's characterised, how it's typically implemented, and the benefits that a company can expect to get from reaching that level. Now, on our maturity model, if you're looking at it now, you'll see that there are 5 levels. However, we do believe there's probably 2 levels before this. One that actually just came up in a webinar last week. It has come up previously, but it came up very recently, where someone asked me, what happens if leadership is hostile towards workplace mental health? Now, I'm hoping with the impact of the pandemic and the increased focus and awareness of the importance for mental health for employees and companies that want to continue to perform and attract and retain, then companies would not be hostile towards it. But you are going to have some people who specifically are companies or leaders who are saying, well, no, mental health is an individual thing. It's got no, the company's got no responsibility for this. It is not what we do here. We create widgets. We don't care for people's mental health. So that's probably the first level, right? Like downright hostility to it, or pushing away responsibility for it. Would you add anything else to that, Alicia or Joelle?
No, it's just that the organization's not actually, thinking it's anything to do with what they can control. It's all up to the individual to look after themselves, and it's almost like this. You're not bringing your whole self to work, and there's nothing in the workplace that's contributing to your mental health. It's something that you go and manage, and there's just no awareness for any type of change and no readiness for change. So you'd need to create a lot of awareness first to actually start to influence some type of change thinking.
Yeah, and it probably ties in with what you were saying about making the business case then, right? Actually getting leaders to understand why it might be something that would be of interest to them, even if they're not morally interested in it. What were the business benefits potentially?
Yeah, so I think that, there's potentially a few different things sitting behind that hostility. So it's maybe a useful first step is actually understanding what's behind the hostility, and then you can address that. So, there are, I think, as Alicia said, there's that still fairly overwhelming perspective that mental health is an individual clinical health problem, and it's not something that would be an organisation's responsibility to manage in the same way that if somebody had diabetes, for example, that's not the organisation's responsibility to manage that. That's up to the individual to manage. And so, because we do have a sort of overwhelmingly clinical view of mental health, it's, I guess, to be expected that lots of organisations would view it in that way. And so, if that's the reason behind it, and it's sort of, they're taking the view that they're potentially overstepping and, becoming involved in aspects of people's lives where they don't have any business to be involved. And that's more of an education process. And, certainly what we find is that when we start talking about work factors and the impact that work factors have on mental health, then organisations start to feel a lot more comfortable because they can actually see how that is their responsibility, and it is their business because they're actually creating those conditions and they have the capacity to influence them. I think the other side of it is just a refusal to acknowledge that work factors or anything outside of the individual has any role to play in mental health, and that mental health is purely something that exists inside somebody. But I think that perspective is probably a more difficult one to shift, and that's potentially where you would start to talk about, well, these are the legal obligations that you need to actually show that you're identifying hazards and assessing risks, regardless of whether you think that that's appropriate or not. In the same way that you need to, you might not think that it matters that you're exposing people to radiation that could cause cancer, but the law disagrees with you, and therefore you're obligated to address sources of radiation in your workplace. So it's that same approach. But I guess that that particular basis for hostility would be more difficult to overcome.
Yeah, I think that first one is something that I have seen in the physical health space. So, dealing with wellbeing interventions like, step challenges or healthy eating. I've had leaders say, well, why do we do that? Because as soon as they get off work or go for a lunch break, they're having a smoke. So why would we, be interested in providing, these physical wellbeing type activities or resources? I'm like, well, but that might be the case, but would you stop then providing them with PPE, if they're in a hazardous work environment? So it's again about that understanding, as you're saying, Joelle, we need to talk about work factors and what is the employer's obligations to manage rather than individual behaviours linked to lifestyle choices.
Yeah, so if somebody likes to go to music festivals on the weekend, that doesn't mean that you don't provide them with hearing protection when they're in a noisy environment at work.
Yeah, exactly. So the next level is where companies actually go, well, you know what, we are actually interested in mental health, and we're coming across a number of them now, if not before the pandemic. Definitely the pandemic has put a focus on this. And they're like, well, what can we do for mental health? And they think, well, we're doing all these activities already. We've got yoga, we've got fruit bowls, we've got, step counting challenges, we've got free gym memberships.
Lunchtime walking club.
Lunchtime walking club. We'll just label them a mental health activity because exercise is good for mental health, right? And now that's our mental health program as well. We've done mental health. What would you say to that, Alicia?
So that's again focusing on the individual employee and what they can do to improve their own health and well-being. Yes, mental health and physical health complement each other, but if you're just focusing on those types of initiatives, you're actually really promoting, it's health promotion, the health promotion activities, right? So in terms of that integrated approach or that maturity model that we're talking about, you're only addressing one aspect, promoting health, and you're down the, immature end of the spectrum because you're only focusing on individual employee initiatives, and it shifts away from preventing psychological injury and harm that may be coming from the work environment itself. So you're not even touching that aspect.
Yeah, and it's like that one level down from where our continuum actually starts again, in that they're just rebadging physical activities as mental health activities, not really thinking about, well, mental health is actually a different beast to physical health. And as you say, whilst there's some overlap, and we know that there's some intersection between the two, then what else can we be doing knowing that mental health is a bit different and the protective factors or the wellbeing boosting factors might be a bit different as well. So those are really the two levels before our continuum kicks in, right? So downright hostility and refusal to actually acknowledge that mental health is a workplace issue, to the next level going, well, yeah, we believe that employees should have good mental health, but we've got all these activities already doing. Surely they must be good for people's mental health as well. So that then brings us to our actual continuum now that we've spoken about the two things that probably precede that, where a company goes, yes, we do believe that mental health is something that we should be servicing within our business. We understand the benefits if people have good mental health for our business, not just, and morally, we think it's something that we should be doing. And this is where companies might start thinking about, well, what are some mental health specific things that we can provide for self-care? Remember that the less mature approach is the individual is responsible for their own well-being. There is not a shared responsibility or an employer input into this. But the employer might decide to provide things like an employee assistance program where people could get access to free counselling. It might be that they provide something like a mindfulness app or a resilience training activity to help them manage stress effectively. So what is the way that a company would typically implement that sort of approach, Joelle?
I mean, generally they would engage sort of third parties to provide that service. So they would engage an employee assistance provider. They would source, a mindfulness app or somebody to come in and deliver training. And then it would essentially be, a comms piece that would go out to employees, letting them know that this is available. It would probably get included in their employee benefits package, for future recruitment purposes. They'd have it, listed in the intranet page and posters and all of those types of things. So it's really just letting people know that these services are available, depending on, I guess, the culture of the organisation and the relationship that line managers have with their employees. Line managers may suggest to their employees, look, I can see that you're having a hard time. I'll just remind you, that the EAP is there. It might be something that colleagues do for each other as well. And then you've also, I think, potentially got those sort of stigma reduction activities as well that might go on. So where we get leaders stand up and, sort of talk about their own lived experience with mental illness, or just generally encouraging people to understand, what are the signs and symptoms of poor mental health, seeking early intervention, encouraging people to do so. You might do things like, sort of leave entitlement. So if, you need to go and see the EAP during work hours, and that's fine, and you can take take leave, sick leave or whatever it might be. So there's those types of things. I guess there's different levels even within that one level of maturity that might, I guess there's sort of having it so we can tick the box and say that we're doing it versus having it in a way that actually encourages and facilitates access.
Yeah, and so if we're thinking about these sorts of activities, typically we're thinking in terms of a control to reduce the likelihood of psychological injury. It would be down the bottom end, so it'd be the equivalent of PPE, so self-care. It's typically done as a voluntary thing, however. So unlike, if you're working in a noisy environment, you have to wear hearing protection, or if you have some falling objects potentially overhead, you'd have to wear a hard hat. This is usually done as this is a wellbeing thing. So it's voluntary. Whoever wants to do it can do it. So Alicia, you've worked in large and complex organisations before. What is the typical uptake of these voluntary kind of wellbeing type activities?
Yeah, look, overall, it's generally quite low. It'll depend on how much you promote these activities through your internal communication channels, like Joel was saying, through posters and flyers or directly line managers to employees. So one, it'll depend on how you're communicating these things. But at the end of the day, overall, uptake is usually quite low. People don't generally, access these activities on an ongoing basis. It might be, if they need them, and it's almost like it's in response to something that's already happened. So their mental health may already be affected. But from even when you think about EAP utilization, it's industry-wide. EAP uptake's usually quite low. It's under 4 to 5%. So not high at all.
Yeah, so if we're only talking about, 1 in 20 actually availing themselves of these services, right? Probably not going to have the greatest benefit for employee wellbeing if we're thinking about the entire population.
Mm-hmm. Exactly.
Yeah, and we're definitely not preventing harm for everyone in a population. It's only, very low level benefit for those people who do, put their hand up and opt in.
Mm-hmm. Yeah, look, I wouldn't even actually classify these as control measures. They sit, in my mind, they sit firmly within the employee benefits side of things. They're not, if you're looking at risk management, none of these are actually a risk management tool. They're an employee benefit.
Yeah.
More nice to have.
Yeah. However, I guess recognizing that it's an easy entry point, particularly for, say, health and safety or HR professionals that want to increase maturity but are finding that their company probably isn't ready for more mature approaches to psych health and safety or psychological health. That's something that we have thought about in our product, FlourishDx, to at least, get in the door. We see it as a bit of a Trojan horse, if you like. Let's bring in something that's easy to implement, something that people kind of sometimes they feel like they're ready for, and then can use more of the product as they become more mature and are more ready to do so, or reach a state of readiness, if you like.
And it's certainly something that's, I guess, almost normal to expect, especially for larger organisations, that they will have these benefits available to employees. I think there's probably not many medium to large organisations out there that don't have these types of benefits available. So there's, I guess, that level of sort of peer expectation as well. Yeah, and you'll find that there's a lot of workplace mental health apps out there that kind of start and finish at this point. A lot of them take basically a public health approach, so direct to consumer, where there's a lot of mindfulness activities or activities to help you sleep or reduce stress or become more resilient. And then they put a dashboard on it for the workplace and say now it's a workplace mental health app. However, we really feel that this is very low level in terms of expected benefit due to low engagement. And like you say, Joelle, not even being a control necessarily, it's more just a benefit. But it's a way in. So some of the things that we've thought about including is at least making sure if we're going to do it, let's do it well. And that's why Dr. Alicia Pappas supervises the content in terms of the mindfulness meditation, actually making sure that it is developed by psychologists with a good clinical basis, rather than being
quote Alicia, airy fairy.
Yes, I do say that a lot, don't I?
Yeah.
No airy fairy.
Yeah. So what are your considerations if we're going to use something like this, Alicia? What does the evidence base or what does the content need to look like?
So from that perspective of what we're offering to individual employees, things like you just said, mindfulness, meditation, stress reduction, all of those things should be, have a scientific evidence base. So things that are focused around, positive psychology principles, maybe even cognitive behavior therapy principles, things that are grounded in science, rather than, what someone thinks or anecdotal evidence. So definitely from that perspective, from, these wellbeing tools, and then moving into, other tools that can assist the organization or the employer. You really need to be providing, risk assessments, psychological, psychosocial risk assessments, or tools that are reflecting what the evidence shows are actual risks within a workplace, what work factors pose risks in general for workplaces, and then what work factors might be more specific to certain organizational contexts. So you need to be measuring, I suppose, the right things.
I think we'll get to this a little bit later, Alicia, when we talk about some of the more mature approaches and the features that we have. But I guess that does bring to mind, like, even things like our wellbeing check-in. Many wellbeing apps will have a mood check-in, but most of them will, again, focus on the individual and what are the individual contributors to mental health, and not consider the psychosocial factors or work-related factors that may also be contributing. And that's something that we have done, which I think is fairly unique, in recognizing that work actually plays a role in workplace mental health, and allowing employees to consider the role of work in how they feel, compared to just purely going, well, I'm going through grief, or I've got relationship difficulties or financial difficulties, and just making it an individual issue. So so I think that's probably, even though we do have a tool that kind of helps to tick the box around promoting self-care and really, just giving people an app that they can access for their own well-being, we at least still, make sure there's a good evidence base behind it, and do bring in the role of work, and educate people around that as well.
Yeah, and even some check-ins, some well-being check-ins, like ours is called a Wellbeing check-in in FlourishDx, but when you're just monitoring your mood, certain apps just ask you to, rate your mood out of 10, or select a mood indicator, but not providing an opportunity to self-reflect and think about actually what is impacting my mood, today at this moment, and thinking about both, like you said, individual and work-related factors. So it's providing a space to, asking a question to self-reflect, which is more of this, creating self-awareness, which is more around kind of CBT principles, and then providing, an exhaustive list of options to reflect on and think about, okay, what is actually contributing here? And I think the key is that's the data that's fed back to the organization. So at least then the organization or managers can do something about that.
Yeah, we'll get to that benefit again. Again, most apps don't move beyond just the individual having a resource that they can go to kind of guide self-care. Again, we see the mood check-in being used in better ways than just that. So basically what we're saying, though, with this first step is that we believe there's low benefit, even though it's a popular approach. Let's just give everyone an app and hope for the best. We believe that there are better benefits as you move down the maturity continuum. But at least when we do it, we do try and make sure there's a good evidence base, and we do try and move people forward and, give those tools for self-reflection, as Alicia was saying. The next level, though, so level 2 of our continuum, is about upskilling the workforce. So this is basically where the company has decided mental health actually is something that we are interested in. We do believe we have a responsibility to address this. It's about them understanding that if they have not eliminated all sources of work-related stress, and no company ever will, that at least like we do with other hazards, like maybe it's dust exposure or exposure to noise or heat or whatever, then we should at least be educating people on how to keep themselves safe. And this is where you would actually put mental health literacy under your competency matrix and say this is a required training experience for people to go through. And so what would this normally look like, Joelle, for a company when we start to consider this is a hazard that needs to be addressed? We're going to bring in an administrative control like training to address it.
Yeah, so I think at this level, you're potentially, so there's mental health literacy. And so there's different ways of delivering that. You can do your typical classroom-based training. You can do through e-learning or, a mixed version of that. But I think that what's really important at this level is that it is, as you say, identified in the competence matrix. That it's clear, what level of training or education is required for different different groups of employees throughout the organisation. And so within that also comes, what is a line manager, what competencies does a line manager need beyond that sort of just basic knowledge in terms of actually providing support to the team, understanding how to refer a member of the team for help when they need it, and how to provide support for a team member when they're returning to work after a psychological injury, for example. In this level, you might also see things like your mental health first aid training or your sort of peer support programs and those types of things. So where you are upskilling subsections of the workforce to be able to identify the signs of potential mental illness and know how to approach it and how to refer on. Not how to treat it, but how to identify, approach and refer.
Yeah, so ideally what you want in a training program around mental health is a range of different delivery opportunities or options, if you like. So not just purely e-learning, blended learning is best. And that's definitely where we've gone with our approach. So not just having videos and engaging content that way to train people about different mental health concepts, but also having leader discussion guides. So it could be delivered by someone in a 10, 15, 20 minute development session or toolbox talk with a group of staff. The other thing that you really should consider, and we definitely have in our product, is thinking about do you cover the whole mental health continuum? So are you just helping people to understand what an illness looks like and where to get assistance? Or are you also giving them some protective information about how to boost resilience and manage stress effectively? And are you giving them some education regarding how do you promote wellbeing using some positive psychology, evidence-based interventions as well? One thing that we also do, which I haven't seen really in a lot of other mental health education, is actually talk about psychosocial hazards and the employee's responsibility in psychological health and safety. So particularly how they can identify the main psychosocial hazards in a workplace, like whether that be work overload, for instance, or lack of autonomy or lack of supervisor support, and how they might be able to improve their working conditions through conversation with their line managers and colleagues.
Yeah, absolutely. And I think, again, developing that common language as well. So we talk about literacy quite a bit so that, when we talk about a psychosocial hazard, everybody actually knows what that means. And when we're talking about, psychological injury, everybody knows what that means. Yeah.
And one of the ways that I've seen companies do this successfully is rather than pushing all of the content at once, they might drip feed it. Or they might do it in groups. So rather than an hour and a half worth of training, they might say, well, look, let's just do 2 modules a week over the course of, say, the next 2 to 3 months in order to get through all the content over a period of time. That way, it's more micro-learning. People are more likely to retain it rather than lose the detail because they've just had so much new information dropped on them all at once. And it could be supplemented by some of those lead discussions as well to make sure that the main learnings are really reinforced over that period of time.
Yeah, and I think that's, we know that that's a much more effective way to retain learning is when it's done in that, through that sort of group participation. So yeah, having the digital content followed up by the leader discussion guide and actually facilitating an interesting discussion within the group about it is going to get the best outcomes from a learning perspective.
Yeah. So I guess one of the things that you need in a workplace mental health app in order for this to work is a learning management system so that you can push content and monitor completion. If you're saying that this is part of our competency framework and everyone needs to do this, or we need to have a certain percentage of people complete this in order to meet your engagement metric, then you really need a way to do that. And a lot of mental health apps fall short here. It's purely just, so if we think about level 1 again, it's a mindfulness app or resilience app that's provided to individuals. People just do that self-service when they like, and they're not necessarily consuming the information that you want to. There's no oversight that they've actually done it.
Yeah, and from a safety management system perspective, one of the things that we do need when we're talking about maintaining competence is that we need auditability. And so that's something that we have deliberately built into the platform, is from the administrator side of it, you can actually monitor who has completed which training modules.
Yeah, so that's only if you push the training course. It's not if people are engaging in the content on their own and self-servicing. The other good feature, I guess, that we've put in based on our customer feedback early on was that if a person has already consumed some content themselves, they've self-serviced in the previous 6 months, if there is a training course that is pushed, then it'll be marked as complete. So they won't have to redo that training because they've already done it. Now, this requires, obviously, Alicia, a bit more engagement and leadership support and maybe resources available if a company was to go down this approach and say, well, this is now mandatory training. So what are the supports that a company might need for this to be effective?
Yeah, so you definitely need to be thinking about how you're going to maximize uptake in a certain time period. So thinking about, if you are shifting from self-service, so having all of this content just available, and then it's up to your individual employees to, engage with it in whenever they want to, moving toward this is mandatory, or these are the learning modules that are mandatory. So deciding on what are core training components, and actually providing communication to create engagement and uptake with your staff before pushing it out through the platform. Communicating with your workforce, what your organization is doing in the workplace mental health space, why mental health literacy training is so important, what the actual literacy is covering. So not just, like you said earlier, it's not just about mental health and illness. It's about educating around responsibilities of both employees and managers when we're talking about psychological health and safety. So really painting a bit of a picture through different communication channels, whether that's coming directly from your health and safety or HR teams to staff, or whether, depending on your organizational structure, from a wellbeing team, whether you use other comms channels like newsletters or intranet, and whether you do cascaded comms, so breaking it even further down and communication coming directly from line managers or department heads straight to their employees. So we find that if you're taking that cascaded comms approach and using different communication channels before you actually push these programs out through, if you're using our platform, for example, you'll get a much better engagement and uptake, especially if you specify a time period to do these programs.
Yeah, one step better if you want maximum engagement, I feel, and I think Joelle's seen this as well, is if you actually give people the time to do the training. So actually put aside the time and say, this day we're all doing the training, versus just trying to get people to fit the training in around their already busy roles. So that's a big bit. The other thing that we've taken on feedback on in the platform is created some core modules so that a company can just set us, then it's only about 20 to 30 minutes of training versus an hour and a half of content that we have in the full course. So a company can do that, and people can get a short course certificate for the core modules, and a company can decide whether they would like to extend the mental health literacy by getting people to consume more.
Yeah, and I think that in addition to putting aside dedicated time, not only improves engagement, but I think the signalling to the workforce is a really important aspect of that as well. That you're actually saying, this is something that we do believe is important as an organisation, and we're actually dedicating a chunk of time for you to do this as part of your workday. We're actually prioritising this time for you to spend in conducting this activity.
Yeah, it can be a bit hypocritical where you're saying to people, we're worried about your mental health, and we know you're busy.
We'll add to your workload.
We'll add to your workload and make it worse. So definitely that's a hot tip for anyone listening. If you're trying to do mental health education, don't just make it get people to fit it around their already busy schedule. Allocate the time for it. And then also think about what's really core, so you're not wasting people's time. And then if my goal with the training, or I should say our goal with the training, is to make the content really good. So they might do the core modules and then go, oh, look, there's all that other content as well that I've got an interest now in checking out. Cool. So that's level 2. And so we expect, there to be better benefits from doing that. Like Joelle said, there's better signaling from the company about the importance if you actually implement that step well. We do believe now we actually have mandatory participation rather than just purely voluntary participation. So that means we can actually make sure that we have much better engagement and much better uptake of the training, which is supposed to assist people. And the other bit, I guess, in terms of your safety management system is that you can track completion.
Yeah.
The next level up is to equip your managers. And really what we're talking about here is not what you would do with mental health first aid. This is down to level 1 again, which is around how do you identify if someone's not doing well and how do you direct them to support. What we're talking about around equipping managers is helping them to understand the role of work in employee mental health, so the psychosocial factors, and equipping them with data so they can have discussions regarding work-related factors and what could be done at a systemic level in order to address the root cause of work-related stress rather than just purely dealing with symptoms. So this is actually, we really feel, a nice, easy step into the next level, level 4, which is around a formal risk management process for psychosocial hazards. This is really just giving people the terminology around work factors and some data around that as well. So, Joelle, this is something, I guess, that kind of came from our Wellbeing check-in. We realised that if we could get individuals to reflect on how they felt and what was the role of work in how they felt, we could provide some information back to the company and to the line leader level just for their team so that they could quickly understand, burning topics, if you like.
Yeah, and I think probably a good opportunity to highlight one of the features in FlourishDx is the line manager permissions. As a line manager, you can actually be assigned permission to view aggregate data for your team, as long as you've got 8 or more people in your team. And so what this does is it actually allows you to see what are the top reasons that people are giving for positive or negative mood, and especially your work factors. And so as a leader, you can look at those positive work factors and say, well, okay, great, these things are contributing to positive mood. So let's get the team together and have a talk about, what can we do to leverage or take advantage of these, or how can we create more opportunities for these work factors to influence people in their day-to-day. And then the work factors that are contributing to negative mood, well, right, let's actually talk about that as a team. Okay, we're seeing here isolated work is coming up potentially as a reason for negative mood. Let's get into that team. Let's talk about what's going on behind that. And is there something that we can actually do as a team to address that? Can we rectify that? Can we reduce the impact of it? And if it's not something that we can do as a team, then as a line manager, I can take that actually up the chain of management and have that addressed at a higher level in the organisation, and then feed that back to the team that, this is what I've done and this is what the response has been. So we recommend, doing this probably on a monthly basis for most teams. And I think that, because that gives you enough time there as a leader to take some action and to have some feedback ready for the team. And you're not asking them to do this frequently enough that it's going to become a hazard for them.
Burdensome.
Additional workload issues for them. On the other hand, I think there's potential also benefit doing this more frequently, particularly if you've got people in roles, customer facing roles where they're potentially having really difficult or potentially traumatic interactions with customers. So you may actually want to do this on a daily frequency so that you can monitor, which members of that team are getting into a higher risk for psychological injury, and then you can actually look at adjusting sort of workloads or assignments, that sort of thing, before they actually get to the point of injury. So there's a couple of different ways to use that tool.
Yeah, and what I really like about it is so quick. So most people can complete this assessment in 30 seconds. You could do it if you're in a work team, when you're sitting in a meeting, go, all right, everyone, let's just do it. The line leader could actually bring up the dashboard and could show them the data, and they could talk through the main issues that have been addressed. So there's complete transparency, which also works very well for engagement if you're showing people what level of data can you see. And look, it's completely de-identified. I have no idea who has actually responded and how they've responded, but it does give us really useful information. And I think it shows a more mature approach, rather than considering that mental health is just an individual issue, to understanding the role that work plays in people's wellbeing, and talking about what can be done quickly and iterate quickly, understanding that hazards can change very quickly. Alicia, you would have seen, working in a large organisation before, the annual employee engagement survey. Sometimes it's received very favourably. Most of the time it's not. We talked a bit about this wellbeing check-in, and we thought, well, this is a great way to get a better cadence of data than just say a once a year survey of an organisation. How do you feel about that, having seen how the other side works?
Yeah, look, with employee engagement surveys, it's not necessarily that clear to staff post-survey, well, what's the outcome of this in terms of what the organisation is going to do about some of the data. So at least with the wellbeing check-in, like you said, if you're doing this in even in a team or a department-based environment, you can actually share the data, in real time, and staff actually become more engaged and are more willing to keep engaging in providing feedback in that way, or completing surveys, because we hear a lot about survey fatigue, and we don't want to keep running assessments and surveys because staff don't want to do them. It's not so much about fatigue as it is about they're fatigued because they don't see the point in it. They don't see what comes from it. So yeah, if something's very quick, like you said, 30 seconds, and they're provided with, data in real time or shortly after, and then there's conversation about it, it seems worthwhile to that person. We're addressing this and talking about it, and we hear a lot the term psychological safety, and it sometimes gets interchanged with psych health and safety, but they're not the same thing. So psychological safety is about being able to speak about things related to mental health, speaking about these types of work-related factors that might be impacting my mental health, in the workplace. So if you're doing these, wellbeing check-ins that take a very short amount of time, having discussions about them periodically, you are actually promoting psychological safety. You are creating psychological safety just by, checking in and having, actual data that can drive responses or solutions as well.
Okay, so to make this work, we really need to equip line managers to be successful. So there may be some training required on how to understand the data and how to have the resultant conversations. I think this is best done, however, if you train up health and safety first and get, either a health and safety person or a HR person who will sit in on the first conversation or two that the line manager has with their team to make sure it's all delivered consistently, that there's value created out of it that is expected, and make sure that the leader is comfortable having those conversations as well. So I think those are things that we need to consider if we're going to implement that sort of approach. But I think this can have a lot of benefit, moving again the conversation from just a focus on the individual and mental health as an individual issue that they bring to work, to also understanding the role that work plays in it and the immediate impact that a line leader can have on issues once identified quickly through this check-in tool versus, this is a once a year activity that we do. Because we all know, Alicia, right? A lot can happen in a year, as you've experienced. And if you're only responding to hazards once a year, you might be missing out on a lot of things that could be really affecting the wellbeing of your team.
Mm-hmm.
So the next level up is level 4, which is now where we go from purely what I'd call hazard identification through the wellbeing check-in tool to doing formal risk management. It's getting us a step closer to the ISO 45003 standard. Risk management is a large part of that standard. And we'll talk a bit about the difference between level 4 and level 5 in a moment. But to understand risk, we need to do more than just understanding what people's wellbeing is like, right? And what are some of the factors at play? What do we need to understand psychosocial risk, Joelle?
So we need to understand what the hazards are in the workplace. And some of that we can do by understanding the nature of work, and some hazards will be inherently present in work. For example, if we've got people who are doing FIFO work, we know that there are going to be some psychosocial hazards that are associated with that. If we've got people who are doing, caring work, we know that, there's potential for things like compassion fatigue and vicarious trauma. Teachers are, likely to be exposed to challenging behaviour from students and parents, etc. So, we can do some of that top-down analysis to identify what hazards are present. But ultimately, whenever we get a group of people together and ask them to collaborate to produce outcomes for us, we've got the potential for psychosocial hazards to emerge. And a little bit like corrosion, we don't always know where it's going to pop up or under what conditions. We just know that the potential is there. And so the best way that we can actually control that is to undertake regular monitoring. And when we do see it starting to emerge, then we can actually develop an action plan to address that, to prevent it from actually creating harm.
Yeah. And Alicia, speaking about employee engagement surveys, one of the things that comes up often in discussions is not just how is FlourishDx different from other workplace wellbeing apps, it's how is FlourishDx different to an employee engagement survey. So how would you answer that?
So FlourishDx houses various different surveys and assessment tools, but the main difference is we have a psychosocial risk assessment. So that's very different from an employee perception survey that just assesses a particular work factor or something to do with the workplace and asks an employee, what do they think about that? Maybe on a scale of strongly disagree to strongly agree. Because if you just leave it at that and you don't actually then take the next step in assessing whether that's having any impact on somebody's mental health, you are only then making assumptions. So if the feedback is coming from an employee opinion survey or an engagement survey, and that asks about, say, for example, workload, and you're asking about, whether someone's workload is high or manageable from that scale of strongly disagree to strongly agree, well, most of us know that, high workload leads to greater stress. So then you would infer that if your employees are coming back with, high levels of workload, that their mental health is going to be more likely to be poor. But that's an assumption, because not everybody that experiences higher workloads is going to have a negative impact on their mental health. They might be having higher levels of job control or autonomy. They might have more flexibility. They might be having or able to have a better work-life balance, and good support from, say, managers or co-workers, and all of those factors might be buffering high workload. And actually, that's not impacting on somebody's mental health. So a risk assessment, as it is in FlourishDx, is actually asking about hazards and whether they're having an impact on employee mental health. How severe is that impact? How frequent is that impact, and how long does that last for? So it's this occupational hygiene approach, and then you're not leaving it up to inferences and assumptions. You've actually got factual data on, is this a risk or not?
Yeah, and that's a key, I guess, nuance for people to understand. Within an employee engagement survey, as you're saying, Alicia, we're looking at employee perceptions, then we're inferring risk. Whereas what we are doing with the risk assessment is that we actually are assessing wellbeing impact. So that's taking into account, I guess, individual preferences and styles regarding psych factor or work design, if you like. So as you're saying, some people thrive on a high workload. Some people also want to check their brain at the door and have low autonomy. And ordinarily, we would assume those two things together contribute to stress. But again, we're just assuming. Whereas I guess where the work factors risk assessment tool originated from was Joelle and I were thinking, well, at scale in a large organization, you can't just run these employee perception surveys and then run a focus group, because you really have to run a focus group following these employee perception surveys if you want to really start to find out what is the actual risk that we're faced with here. Companies aren't going to do that. So what's a way that we can get that understanding of severity, frequency, and duration of hazard exposure rather than just assuming it? And so that's where the risk assessment was born. And then coupled with the wellbeing check-in, where we're getting a good understanding of what hazards are actually present, we can then tailor the risk assessment to only choose the hazards that we're interested in assessing, rather than, say, another style of survey where it might just be a standard battery where you have 30 minutes or 40 minutes worth of questions for someone to complete, and half of them are irrelevant to the role or the industry. So the risk assessment was built with that customization available. And as you're mentioning as well, I can't remember if it was Joelle or Alicia that, I think it was you, Joelle, talking about when you talk about teachers, they've got some very specific hazards like student challenging behavior or relationships with parents. And we need that customization. We have that built into the risk assessment now.
Yeah, so I think importantly, if you're looking at our risk assessment, to cover a decent chunk of hazards, you're looking at about 10 minutes for people to complete that survey. And that's a big improvement on most of those perception style surveys that you will get. And there's a lot less words involved. So literacy issues that might be an issue for some of those perception surveys become less of a problem, because essentially people are just presented with the definition of the hazard, and then they're asked to rate it on those three factors of wellbeing impact, frequency, and duration. But then I think the other really useful aspect is the data analytics side of our platform. So you can filter down to different groups within the organisation, and often we will see that different functions or different professional groups will have different hazard profiles. So your operational staff will have very different hazard profiles probably to your administration staff. So the ability to filter any which way you like is a really powerful tool in our analytics offering. The other thing that I really like about it is that you can actually see the percentages, the average percentages that people have given for each of those three ratings. So the wellbeing impact, the frequency, and the duration. And you can actually then say, all right, well, how can we design an intervention to reduce one or all of those factors? So can we reduce the severity of impact that people experience as a consequence of this hazard? Can we reduce how frequently they're exposed to this hazard? Or can we reduce the duration of exposure to that hazard? And once they've designed that intervention to say, right, we're going to focus on reducing frequency, then they can come and reassess again in 6 months' time or 12 months' time. We were targeting frequency with this intervention. Were we effective or not? And you can see whether that percentage has actually shifted in line with what you expected. So you're actually getting a much better evidence-based feedback on the effectiveness of your interventions.
Yeah, and the other thing that we're building towards and should have available before the end of the year is a total risk score, a risk score for each factor and a total risk score that is actually linked to a longitudinal outcome, including burnout and psychological distress. So whereas the result of a lot of psychosocial risk assessments using employee perception style surveys is that you'll get a score out of 7 or 10, and it'll be compared to a benchmark, and then you go to infer what you will from that, how you compare to a benchmark. With ours, it will actually be linked to a risk outcome or a psychological injury outcome, if you like.
Yeah, and ultimately, looking at different patterns of hazard clusters as well, and the likelihood of particular groupings of hazards in leading to a psychological injury.
Yeah, that's one of the deficiencies of the current approach as well. We typically look at each of the hazards in isolation and look at what the level of risk is for each, whereas we also want to understand, well, what is the combination? Like if we have low supervisor support, low autonomy, high workload, how does that influence the total psychological injury risk rather than any of these independently affecting each other? As Alicia said, if you've got high workload, but then you have high supervisor support and high autonomy, then those might buffer the effects of the high workload. And so really we need to understand, what is the total risk as well. Not saying that we should ignore hazards, but we should definitely prioritize them and have a way of tracking, are we actually making progress on actually reducing the injury risk profile for our staff? Now, to make this work, there does need to be, a stronger level of management commitment again. Probably at this point in time, because a risk management approach is about continuous improvement. It's not a one-off activity. It's something that you want to go back again, monitor whether your controls have been effective, and then make changes and act again and again. And you'd probably do that on a 6 to 12 month cadence. You really probably need to, at this point in time, include it in your risk register if you haven't already. You need to include it in your OH&S policy or a similar policy, which states a commitment that you understand that psychosocial risks exist, that the employer has an obligation to deal with these, and that you will periodically assess for risks and put in actions. Mm-hmm. And like our wellbeing check-in, it is important to commit to doing actions. It's not, we really don't want it to go down the route where we're collecting data for the sake of it. Hey, look, we got all these colorful graphs and charts now. Terrific. Measuring is not an intervention. You actually need to do something with the data. So there does need to be communication up front about what's going to be done with the data. And the action plan does need to be developed in consultation with staff and distributed to staff for feedback before being finalised, so that there is that consultation that is needed throughout that whole cycle. Mm-hmm. So as you can see, as we're talking about with the maturity approach, this is a lot more difficult than just giving everyone access to an app or some resilience training. But then we also expect to see some better benefits in terms of mental health outcomes, because we're dealing with it not just from an individual and voluntary perspective, but now it's actually becoming more of the fabric of how we operate as an organisation, and we're improving work so it's healthier for people. Yeah, terrific. All right, well, that brings us to our last level, and I'm really glad to have a ISO 45003 expert on the call with me. Even though I'm the face of the 45003 Training Academy, it's Joelle who's the one that's busy behind the scenes actually writing the content. So she is our ISO expert, if anyone wants to DM her on LinkedIn later. But that's the next level, right? So adopting international best practice. So Joelle, seeing as you are the expert on the call, how is adopting ISO 45003 different from just psychosocial risk management level 4?
Yeah, so psychosocial risk management is one part of an overall management system, right? So that's identifying your hazards, assessing your risks, and hopefully implementing actions. But that's just one piece of the puzzle. So ISO 45003 is a child standard of 45001, which is the standard for safety management systems, and that essentially is it's a holistic approach to a management system. So it starts with understanding the organisation and its context, and it goes through, planning, resourcing, leadership or top management commitment, competency development, embedding all of these things right across the different functions within your organisation, so that you do actually have a system of work that is sustainable and that's replicated over time. It's auditable, all of those good things that we know are necessary for a robust and effective management system. So you go through all of the planning, all of the development work up front before you even get to the point of actually doing a risk assessment. And then post-risk assessment, there's all of our still, return to work aspects of things, so that if people do still become injured, we've got processes and practices in place to help them return to work in a safe and healthy way, and help them to reintegrate into work and support them in that. And then we've also got the continuous improvement aspects that are there within within any of those types of management systems that are aligned with the 45,000 group of standards. So it is a much more holistic approach, but it's certainly a way of ensuring sustainability over time, rather than having, the risk of it being a once-off intervention and then we forget about it, or it gets too difficult, other things take priority. When we actually embed it through all of our systems, it becomes part of the fabric of our organisation and really just part of how we do business as usual. So within FlourishDx, we have developed a feature called the Flourish Factor, and it's a step-by-step guide for organisations to self-implement ISO 45003. So it's really, we've done the hard work for you. We've broken down the standard into a number of, I think it's 23 requirements. So in each requirement, it gives you a bit of information about what the standard says. We've got some video content in there if you don't want to read, and then we've got recommended actions. And where we do have other features within the platform that will help you to deliver that action, those are linked. So any technology solutions that we can provide to help you meet those actions, we do. Unfortunately, not all of them can be done with a technology solution. We do still need a human brain to do things like understanding the organisation and its context. But certainly where we do have those links for the technology assistance, those are included in there as well. So you're able to track your progress as you're implementing the standard, and you can sort of see how you're progressing against each of the content clauses as well.
Yeah, so I guess I was asked the other day about how level 4 and level 5 might be different, psychosocial risk management versus ISO 45003 adoption. And what we're talking about is psychosocial risk management can be done as a standalone activity. It doesn't need to be integrated into your safety management system. You don't need to be thinking about, leadership commitment. You could do it potentially without leadership commitment. It's still better if you do have leadership commitment. You don't need to think about competency requirements. You don't need to think about return to work with psychosocial risk management, whereas ISO encompasses all of those things and more.
Yep, incident response, investigation processes, any of those types of things. Yep.
Yeah, and auditable as well, as you say. So it's as you can see, it requires a lot more work. Again, through the Flourish Factor feature within FlourishDx, there is some guidance on how you can adopt that. So we feel that's probably the easiest way. And in fact, that's one of the goals of FlourishDx, be the easiest and most cost-effective way for a company to adopt that standard and measure performance against that standard if they wanted to. And so the Flourish Factor, we really feel goes a long way to doing that. And look, we're probably not going to talk any more about the ISO standard at this point, because we have been going for a while and we have a whole training course on this.
We do.
Yeah, so you can find that training course. We have a foundations course at www.45003.org. Good name for it, I believe. It's so you should be able to find that very easily, and that will take you through the whole standard. And also within FlourishDx, you now have access to on freemium, on the basic plan, you do have access to the first few steps of the 23 action steps that Joelle was mentioning of the Flourish Factor. And then for premium or enterprise accounts, and you have access to the full thing. Yeah. So look, we're hopeful that this maturity continuum will give companies and yourselves more context regarding, what is a workplace mental health solution? What are the things that we should think about? And hopefully it answers the question finally, Alicia and Joelle, how is FlourishDx different to other workplace mental health apps? So really, if you consider most apps kind of starting at level 1 and finishing by level 2, We really feel that we can service companies from all levels of maturity, from those very early stages right through to ISO 45003 adoption.
We can grow with you.
That should be in marketing, Joe.
No,
Flourishing, growing. It's great.
that's all I've got. That's it.
So we left you off that last one, Alicia. Is there any other comments you wanted to make regarding the that last step, or the maturity continuum in whole?
Just to add that, I think you mentioned earlier, it's not. It's a lot of work, I suppose. It's you have to think about, who's going to oversee this, where does this actually sit in terms of, who owns this, I suppose, in an organisation, and who do you need to work with and collaborate with to make sure it's a continuous process.
Yeah. And so, there's easier things, right, and then more difficult things as you progress. And so, again, like I said, hopefully for those health and safety professionals that want to do this well and do it properly, then you can convince your HR colleagues that, hey, look, this is a Wellbeing app that ticks all the boxes. It's very nice. It does everything well. There's a good evidence base behind it. But then you can start to use more and more of the features to move your company further towards that the right end of the maturity continuum, where you expect to see greater benefits for psychological injury prevention and wellbeing promotion.
I think really importantly as well, which we haven't mentioned, is that this is actually relevant to businesses from small businesses of 8 people right through to multinationals with thousands of people. The complexity grows obviously as the organisation grows, but the tools that we have available in FlourishDx will be effective for you if you do have a very small business, to help you to understand what are the psych hazards present in your business and monitor those over time and give people the basic training that they need. We're there for businesses of that size as well. We're not just focused on big business, and I think the level of data analytics that you can get for a group of 8 people is actually going to give you quite a lot of useful insight at that small business end. So, it's not about being a small business and trying to adopt an international standard necessarily, but it's about having the tools there available for you to do what you need to do to meet your obligations that are reasonable for your business.
Yeah, and obviously creating a better benefit for employee mental health.
Yes, absolutely.
Versus surface level kind of initiatives.
Yeah, I mean, retention for small business is huge. Having a happy and productive workforce is huge. And I'm not saying that big businesses don't care about their employees, but I think as a small business owner, you do have a much more personal relationship with your employees. So there's potentially that added sense of, I don't know what you would, psychological capital that you want to build with your employees, and you do actually want to do things that are genuinely going to support them, and that have evidence sitting behind them that is going to be effective. So please don't think that this is just a tool for big business.
Yeah, and in fact, that is something that we did consider. Obviously, there are other free tools out there for doing risk assessments that are out there that are provided by government, but unfortunately, you need a minimum of 20 people to get data back. And so, that is something that we're very conscious of when building this, making sure that smaller teams and companies could have access to something that was valuable. And obviously, as we've talked about, it goes well beyond just psychosocial risk assessment to also providing education and tools as well for wellbeing.
Yeah.
Yeah. Well, I think that's enough. This is probably the most we've ever spoken about the FlourishDx platform on a podcast episode, and we did provide a public service announcement up front and a warning that would be the case. But we really feel that this maturity continuum is something that's going to help people to understand where they're at maybe a bit better, think about what's actually required to make an impact, and maybe increase maturity within your own business wherever you start. So thanks, listeners, for tuning into this episode. As mentioned at the beginning, this will be available on the FlourishDx YouTube channel as well. And there should be links in the show notes and through YouTube to the Continuum itself, so you can follow along or refer back to it at a later stage. If you check out LinkedIn over the coming week, you'll probably see that we have a clip or two on here. We do like to have short clips from our podcast episodes on the FlourishDx LinkedIn page. And while you're over there on LinkedIn, feel free to connect with Alicia, Joelle, and myself. Hopefully, we've stimulated some questions that you might want to ask us. So just slide into our DMs and we'll be happy to chat. So thanks a lot, listeners, and we'll catch you next episode.